Okay, are we all ready to start?
I am.
All right. Well, hi, everybody. Thank you for spending the afternoon or evening with us, wherever you are. Welcome to the American Journal of Sexuality Education lecture series. My name is Bill Taverner, and I'm the chief editor of the journal. Before we get started, just a few announcements. These announcements may be familiar if you've been with us the last couple of times, but I just want to make sure that we're all on the same page. I'm very pleased to say that we're partnering with the Tennessee Alliance for Sexual Health, also known as TANASH, to provide ASEC CEs for this and for all of the sessions. If you've already signed up for CEs, we'll send you a sign-in sheet and an evaluation after the session. You need to complete the evaluation in order to receive ASEC credits for this session. If you have not signed up for ASEC credits and you want them, we'll send you an automatic email after the session, and that will have instructions for signing up. And thanks so much to TANASH for providing them. I'm pleased to be working again with Debbie Rothman, who will be assisting with moderation. Hi, Debbie. There's a chat box. Please use that to say hello to each other. If you want to take a moment to say where you're from and how you're doing, that's great. And that's also a great place to share ideas. And our speaker may be using the chat to get responses and reactions to different questions as well. If you do have a question that is not in direct response to something that the speaker is asking, put it in the Q&A box, and that's where Debbie and I will be spending our time moderating so that we can lift up questions that you have to the speaker during the Q&A session. The recording of the session will be available after the session. You should be able to use the same credentials that you logged in. If it doesn't work, we'll troubleshoot that. Just email me and we'll figure that out. So I'm pleased to introduce our speaker for tonight. Goody Howard is a sexuality educator who hosts sex positive workshops around the country that are focused on intimacy and empowerment. She lays her focus on pleasure and education with her energetic and engaging presentation style. She also teaches comprehensive sex education and provides sex positive professional development workshops for social workers, counselors, therapists, and healthcare professionals nationwide. Goody has been educating on campuses, in communities, and for companies for over 14 years. I had the pleasure of watching Goody present a workshop in person at the North Carolina Sexual Health Conference last year, and it was one of the best presentations that I have ever seen. Welcome to our speaker, Goody Howard.
Hi. Hello. Thank you so much, Bill, for that amazing introduction. I hope I can live up to that one. But I'm excited about this because I love AGSE and I'm excited about the CEs. So thank you, Deborah, for helping partner and make those happen. And we're just going to dive in. I know some of you guys have been on for a long time because we had a mix up with the time, and I appreciate your patience and your flexibility where that's concerned. So we are going to get started. My name is Goody Howard. My pronouns are she and her. And hopefully you guys are putting your pronouns in your presentations and at the signature line in your email and in your social media profiles. We really need to normalize pronoun sharing. Just my quick little PSA. We need to normalize pronoun sharing for cisgender folks so that transgender folks are not outing themselves when they disclose their pronouns. Okay. So let's get started. The sex toy story. I'm so excited to share this with you guys because when we talk about sex toys and pleasure accessories, we don't usually consider them as part of the sex ed space, definitely not of the medical support space. And so this presentation is going to connect all three of those dots. So, like I said, my name is Goody Howard. I'm a sexologist, educator, consultant, speaker, and I've been doing this, like Bill said, almost 15 years now. And I just really love what I do, and I'm excited that all of you guys are here to spend a little time with us to learn some things today. So when I talk about sex toys and pleasure accessories, I'm talking about in the continuum of care, but I'm also talking about how they can support people that have sexual health difficulties and their partners. Because when we can connect to pleasure, even in the midst of some sort of chronic illness or concern that's impacting our sexual function and pleasure, it helps with the healing process. It helps with navigating that, and it also helps reduce stigma around pleasure during those times in our lives. So there are lots of different types of sexual difficulty. And if you notice, I'm not saying disorder. I think we hear erectile dysfunction, erectile disorder. I'm going to say erectile difficulty, sexual challenges, because language is alive, okay? And it lives on and in people. When you speak it to someone, it stays with them. And so I want us to kind of shift the frame of language that we use, because remember, I'm talking about from a sex positive perspective. And if we're thinking sex positively, we are reducing shame and stigma at every turn. And to that end, that means we're going to need to change our language in a lot of ways that we may not have thought originally. So you're going to hear me say sexual difficulty and sexual challenge. I may fall back on disorder just because of the nature of the language that's used, but I'm going to say difficulty and challenge just because I want you guys to adopt that language as well. So we have arousal difficulty, desire and orgasm concerns and challenges, and then some pain difficulty as well. So range of motion, pains during intercourse, and things like that. What I want to talk about is just how it shows up for us. Okay, so some of the causes of sexual difficulty is like, hormonal changes, especially in people in bodies with vulvas. Okay, bodies with vulvas tend to have hormonal changes around menopause, birth control, because birth control is hormonal for the most part. And things like that. And then bodies with penises tend to have sexual difficulty around testosterone increase or decrease. And it really is about your hormones and things like that. And then you have like circulation issues, hypertension and diabetes. And interestingly enough, hypertension and diabetes themselves do not impact sexual function, but the medications that treat those conditions absolutely do. And so if you have hypertension concerns or diabetes concerns and you're not connected to medication, you may not have erectile difficulty, but once you get on the medication, it becomes a concern. And that's really the top reason why people with penises discontinue the use of their medicine. Okay, and so that's why we're going to talk about some things that kind of help with that so that people can stay on their meds until they get those conditions under control. Kidney failure, menopause, cancer, emotional stress and trauma. You guys, this is a big one right now because we're in the middle of a pandemic, right? Emotional stress and trauma is at an all-time high for most human beings, especially human beings in America. So when we talk about stress and trauma, it really takes an active effort to disconnect from what's going on with the rest of the world to connect to your pleasure. And when we're in survival mode, which most of the country is in right now, you kind of disconnect from thriving mode, which is where pleasure can actually take place. So it's a very conscious decision. And I want you guys to be mindful of that because you may be coming in contact with people in your classes or in your practices that are just kind of disconnected from their pleasure right now, or their libido is low or challenged just because of the stress of living in, a COVID world right now. So vaginal dysfunction and penile dysfunction are very, very different. Okay, so vaginal dysfunction comes from hormonal changes, but the way those hormonal changes show up in our sex is very important. So it changes the skin of the vulva. The skin of the vulva gets more firm. It doesn't get as moist as quickly. You may have some changes in the way the moisture even occurs. The vaginal lining changes. So when the texture of the skin of the vulva changes, the sensation and stimulation changes. So it takes a little bit more to stimulate a clitoris that has a tougher skin or a firmer skin or a less elastic skin because there's a different a lack of hormone being produced. So those types of things are challenges, right? Blood flow challenges, all those types of things are directly connected to hormones. So when our vulva skin changes, the skin on the clit changes, the skin inside the vaginal canal changes, and then it needs more stimulation to start the arousal cycle. So WebMD, it's you either love it or hate it, right? So you go on there, you may think you have cancer, but you really just have, an ingrown toenail. Who knows? But 60% of women said they had some type of sexual dysfunction or disorder, and that was between ages 21 and 30. And what happens is the society that we live in doesn't really highlight sexual dysfunction or disorder with female bodies or bodies with vulvas. And so we just think, oh, it's just a part of life. We're just getting older and we just accept it. It just is what it is. And we don't talk to our healthcare professionals about it. We don't talk to our therapists about it. We don't talk to our friends. And so there's a kind of a veil of shame that happens around feminine sexual disorder. And I think that that's because we're just conditioned to just accept it. So then we're saying erectile difficulty, we're talking about penile erectile challenges. And most men say they have those challenges. They'll say, oh, you know, but men don't take it lying down. People with penises will ask their doctors, they'll ask their friends, their therapist, their barber, their mailman. They're gonna ask anybody that they think may know how they can get around those challenges for some support. And that's why there are like 15 ED meds on the market right now and one sexual dysfunction medication for female bodies. So the medical interventions I was just talking about, you see there are some hormone replacements, there's some creams and some pills and some lubricants and things. And there are also the medications like the Levitra and Cialis. Now the ADDYI, I pronounce it Addy, is designed for people with vulvas, but the other ones are designed for people with penises. But then there's even more medical intervention for people with penises. You got injections, you have, you know, you can get an injection in your penis. You can get an injection down your urethra. You can get an implant, a surgical implant. So they have the semi-rigid implant that kind of, it's semi-firm so that it kind of, you already are almost erect all the time. So then when you start to get aroused, it just supports the erection that you can have. And then you have the inflatable kind that are flaccid most of the time. And then you have to move the testicles to inflate the implant inside the penis, which I know that sexual pleasure is a big deal and it's very connected to masculinity and male identity. And I think that's kind of unfortunate, but also the length to which medical science has gone to support and or dissuade erectile difficulty in people with penises is just fascinating, because the same type of medical intervention does not exist for people with vulvas. I think these types of inventions and interventions are best served for trans folks because they are the ones that are going to, like, it's not a medical condition that they're needing these interventions. And so I think from a perspective of accessibility for trans folks, this is amazing. But when it comes to the lens of accessibility for people that are experiencing erectile difficulty, I think we really have to consider the concerns around that. And that's another reason why sex toys are great and pleasure accessories, because they're not invasive, they're not medical interventions necessarily. They're easily accessible financially for the most part, and they kind of support without the downtime and the bodily invasion, right? So what I'm gonna do now is we're gonna open up this chat. Now, I need your help, Deborah and Bill, because I can't see the chat because I'm sharing my screen. But I'm gonna show you guys a couple of sex toys. And I want you to tell me what you think they are and what you think they're for. Okay? All right, toy number one. What do you guys think that is? And what do you think it's for?
Okay, a vibrator for clitoral stimulation.
Yes.
Oh, and someone else is saying strap on to a vulva for clit stimulation.
Yes, that's exactly right.
Sorry to get it so fast. That wasn't me knowing this. You know, I would have gone with spider.
It's a butterfly, so you're close. And so with that one, I'm actually going to just explain them to you as we go through them. And then I have some that are not in the presentation that we're going to talk about. But this is that butterfly that's in that picture, okay? And so this strap actually goes around the waist, and this strap goes around one leg, and this strap goes around the other leg, and it just sits on the vulva, and it sits on the clit. This is the clitoris. It sits on the clit like this. And so it stimulates the clitoris with vibration because it has a bullet inside. And you use lubricant with it. And the reason why this is a great accessory when we're talking about, you know, bridging the gap in pleasure is because if for a female body that's having some sexual difficulty or some erectile difficulty, you can apply a generous amount of lubricant, which is also an intervention in and of itself. You apply some lube, which softens the vulva skin and all of that, and then it reduces friction. So something like this, the vibration and the pulsing from something like this on the clitoris can then start the arousal cycle like a jumper cables. It kind of like boosts onto the sexual cycle. I like this accessory because not only is it external, it's wearable, it just sits right on the vulva, but you can also have penetrative sex with this on. Now you can't necessarily do it in missionary because then this would like end up here somewhere. But it's great for if entry from the back, doggy style, or getting on top, partner on top positions. But something like this actually connects to the pleasure because it vibrates in a way that the human body can't. And so it, like I was saying earlier, when we have hormonal changes, especially in bodies with vulvas, that skin on the vulva changes. So it needs more stimulation, it needs more vibration, it needs more manipulation to become aroused and start the arousal cycle. Okay, so something like this, it's a real easy fix. I'm not gonna say a real easy fix, but it's something that's not as invasive as some sort of medical procedure. All right, what's that one?
Goody, I just want to acknowledge we do have someone with their hand up. Do you want to hold off on questions till the end, or?
I'm very interactive in that way. If they have a question, I appreciate respect of the hand. So absolutely, read me the question.
Okay, well the hand is down now. We may see a whole bunch of hands go up. But I'll keep if other people want to ask.
Okay, and then if you see a Q&A that's relevant to what I'm talking about, just let me know, because I like to talk to people while I'm presenting because they may not remember their question at the end, and if it's relevant to what I'm talking about right then, they're probably not the only one with that question.
Okay, we do have a couple of questions, but I think these are not relevant to what you're talking about now. We can circle back to them later. Is that okay?
Okay, perfect. So the next one, what do you guys think this is?
So we have some guesses here.
Okay.
A cock ring.
Okay.
A cock ring that will rub to clit while having intercourse. Let's see if there's another one up here. Nope.
Everybody's guessing cock ring?
So we got,
I'm seeing C ring.
Yeah, C ring.
Yeah, that's the PC way to say cock ring.
Here's a question.
Yes.
Can it be inserted?
Yes. Okay. The question is, can it be inserted? Was that what you said, Deborah?
Yeah.
Yeah. Or they're stating that it can be inserted.
Yes. So this is a Purple Pleasure cock ring. It's body safe silicone. It's rechargeable. It actually, if you see right here, that's where the charger goes. It has a little pin charger. And it's body safe silicone, which I like. All toys are not. But this sex toy is basically, it is a cock ring, but it has multiple uses. So the cock ring, essentially, the function of a cock ring is it's lubricated and you slide into the base of the penis and it keeps the blood flow in one side of the penis. Similar to when you wrap your finger with a rubber band and it keeps all the blood flow on this side of the rubber band. It's the exact same concept. So it keeps the blood flow in the penis a little longer. So it helps with stamina. It helps with maintaining an erection. And so that's why the cock ring is great, because something like this, it stretches, of course. But when you lubricate and use something like this, it's something that you can still please your partner with. So you're still involved in the pleasure if you have a penis. But also you can take and this part vibrates. So this is a clitoral stimulator. This is a perennial stimulator if it's two people with penises having sex. So it's a great vibrating stimulator. But then you can also take the penis out and put your fingers in it like this, and it becomes a clitoral stimulator. You can use it while performing oral sex on a penis. You can use it to stimulate the testicles during masturbation or during oral sex. So it has lots of different uses. And then this can absolutely be inserted into the anus or into the vagina. And because it's about 2 inches, it's going to stimulate the prostate if it's inserted into the anus, and it's going to stimulate the G-spot if it's inserted into the vagina. So this sex toy is very versatile in the sense that you can use it for any space, body, right? Any body part, any kind of sex. You can use it on the penis and a vulva. And what I like about something like this is it's not huge, right? It's very small. It's not intimidating in that way. And it's not penis shaped. Okay. One of the biggest concerns I get from people, specifically hetero couples, is where the female partner is concerned about bringing a sex toy into the bedroom with her partner. Especially if something like this kind of low-key insinuates that they may need some sort of erectile support. So they may feel a way about that as well. But something like this, because it's not big and it's not penis shaped, it's not going to be offensive or intrusive to the hetero male partner, because typically that's the biggest concern that I get from hetero male clients, is that they don't want, when they think of sex toys, they think big penis shaped vibrators, and they're like, you know, I'm the only penis that should be in the room, yada, yada, right? So when you're trying to overcome those rebuttals, something like this is going to be small enough, but effective enough to convince them that it's worth a try, and to where they don't really feel intimidated or offended in any way. So this is actually one of my favorite sex toys. And again, this is great for if you have erectile difficulty with a penis, it's great. If you have sexual dysfunction issues and you have a vulva, again, this is great for you too, because with lubricant, you can use it. And I think from an educational perspective, as educators, as practitioners, the biggest thing that we need to understand from a sex positive framework is that we need to introduce accessories from the perspective of that the pleasure is a right, not a luxury, and that there's not just one way to have sex, there's not just one way to engage in sexual pleasure, and that these are enhancements, not replacements. So when you think about the stigma associated with sex toys and accessories in general, a good way to ease that stigma is just to highlight the benefits of them and how well they work and the various ways they can be used. Okay, because you don't want to make assumptions that your clients are heterosexual. You don't want to make assumptions that your clients are, you know, cisgender. So these types of accessories, I'm teaching them, when I'm telling you about them, I'm using penis and vulva and things like that, because those are ungendered terms. And again, we want to do a sex positive framework. So as educators, as practitioners, as counselors, therapists, whatever your line of work is in the sexuality field, you want to make sure that you're creating a space that is conducive and cohesive to them being receptive of what you're teaching, but also that it's accurate and that it resonates with them in some way. Okay, and this is one of the great, like, universal toys. These and the bullets are very universal.
I have a couple of questions here.
Okay.
One, if this goes back a bit, how do you identify if the skin has changed? The skin on the vulva, skin in the vagina?
You would basically just be a series of questions to your client. If you're talking about yourself, you'll notice that it takes, and even with your client, you can let them know, it'll take more stimulation perhaps to reach arousal or orgasm, more vigorous manipulation of the vulva. Maybe it takes longer to get aroused. They'll notice changes, just the texture of the skin. So the skin of the vulva is usually very supple and very smooth. So, and also has a slight moisture to it, usually, like the inner labia, etc. And so when the texture of the vulva changes, it becomes less supple, so it becomes more rigid, and it doesn't have that moisture factor either. So you'll notice, if your client is there, they'll notice. If you just ask them, have they noticed any changes in their vulva, in the texture of their vulva, they'll be able to tell you. And if it's your own personal body, again, it just takes more time to get aroused or to stimulate or reach orgasm.
And another related question is, can that lead to pain?
It can lead to pain, absolutely. If for no other reason than because it takes more stimulation to reach orgasm or reach arousal, you may pass the point of arousal and enter into a discomfort area. Also, that's why lubricant is a very low barrier to entry intervention, that people often they shy away from because they think it's a commentary on their ability to have sex or a commentary on their sexual prowess, when it is not. So lubricant reduces friction, but what it also does is it helps moisturize that rigid vulva skin, and it also helps you feel the differences in the texture of the vulva. Okay, and even for a penis, it helps you feel the changes in texture, because even with hormonal changes for people with penises, they can also notice a change in the skin on the head of the penis, the texture of the skin, the sensitivity of the skin, as it were. And so it's not difficult to recognize those changes in your own body.
And here's a real quick one. When you talk about each of these, are you able to give us sort of a general ballpark cost?
Oh, sure. So all the things I'm showing you guys today are on askgoody.com. And everything is less than $50. Everything I'm showing you is, most of these toys, I think there are like 2 that may cost almost $100. But yeah, so when I say low barrier to entry, that's what I mean. That's going to be cheaper than a lot of medications. It's going to be cheaper than a lot of medical interventions. And so the sex toys are really accessories that are cost effective. Well, the ones that I sell are, because I think that pleasure, again, is a right. It's not a luxury. And so it should be accessible. I think that pleasure is a revolutionary act. And I think that if it's not accessible, it's not revolutionary. So yeah, everything that I'm showing you guys is $100 or less. Most of them are $50 or less.
Goody, the questions keep on coming in.
Okay.
Do you want us to continue, or?
You can use your judgment. If you can eyeball it and see if it's about this toy or if it's about something else, and we can get to them at the end.
Okay.
Yeah, because I can't see it, so I have to.
I think these are general questions. Debbie,
Okay.
Do you see something you want to pull out?
Well, this one's about safety.
Okay.
About sex toy safety. Do we know what materials are to be avoided? What brands we know produce body safe toys? Do we know how to test if a sex toy is safe?
So when it comes to body safe toys, I say body safe silicone toys are universally safe for the body, and that's medical grade silicone. Okay, there's no specific industry or brand that just exclusively produces body safe silicone, medical grade silicone accessories that I'm aware of. And so something like this, something that's made out of like this judgy jelly material, those are going to be the toys that are not, they're body safe, but they're not the kind that can be inserted. They should not be inserted. They should only be used externally on the vulva or the penis. The medical grade silicone accessories can be inserted safely into the body. And that's another way that lubricant shows up, because lubricant also has to be body safe. Now, water-based lubricant is your best bet when you're talking about using sex toys, but all water-based lubricant is not created equal. So you want to make sure that the first ingredient is water, or there are no parabens and glycerins and things like that in the lubricant. Now, that's just because if you have a sensitivity, you may have a concern. Now, if you don't have sensitive skin and things like that, you can use lubricants with glycerins and parabens and things in them. It's not going to hurt you if you're not sensitive. It could just, at the most, it'll cause irritation. So a good way to test it is to like just put a little bit on your inner elbow skin right here, because this is a very sensitive area, and just kind of put it on there and see what the reaction is, if there is one. And that'll let you know if you have an aversion to that product.
And here's just a comment. They need to be better at doing more research and help for people with vulvas.
Yeah, because the industry, when it comes to sexual dysfunction specifically, the industry leaves us out, because people with vulvas just take the L. We just say, oh, we're older. It's a part of getting older. It is what it is. Whereas, like I said, people with penises are not taking this laying down. They're talking to everybody and anybody about how to, get around that. So yeah, I think it's important to have more research and insight into how to support people with vulvas around sexual dysfunction concerns. All right, we're gonna move to the next one.
Sounds good.
This one, I'm not even gonna let y'all guess because it's obvious what it is. Well, to me, it's obvious what it is. This is a wireless remote control bullet. And if you see, I actually have one here. So these are, again, this is a body safe medical grade silicone accessory. And it has the cord here because it has a flared end. So some people can use it, you can use it anally or vaginally. I don't think that this end is flared enough for anal use. If you're familiar with anal play at all, it'll suction in, and so it may go in too far. But it has a little flared end, but it also has a ring so you can get it back out. And then this is the remote control that goes with it. They are both body safe silicone. They are both rechargeable. There are no batteries or anything like that. The reason why something like this, the remote toys are really good, is because it engages both partners in the pleasure. So let's say there's a partner that they are having the sexual challenge and their other partner is not. So then they will insert this like vaginally into their partner, and then they get the remote control so they can still contribute to their partner's pleasure. If it's someone with a vulva that needs more stimulation and things like that, they can still use this and their partner can connect to helping facilitate that pleasure. So remote toys have their own layered levels of pleasure and intimacy. And I tell people, intimacy is what happens when you're not having sex. And I think that from the perspective of accessories and pleasure accessories, things that are like remote controlled, or it's like a two-player game, you're getting to share in the experience together. So it adds that layer of shared intimacy, which makes it even more connective, and it just adds to the pleasure.
Goody, if I may add an observation, I don't know if you're going to speak to this at all, but things that operate remotely might have additional use during a pandemic. You know, when people are not able to be as close to each other physically. Have you any thoughts about that, or am I off the wall there?
Oh no, you're absolutely right. So remote toys have a great, they're having a resurgence right now because of the pandemic. Not only, so something like this works within 50 feet. The remote works up to 50 feet on this one. But then there are some that are controlled via satellite and via like Bluetooth and things like that. So you could be in a different household. You could be in a different state. You could be in a different country because it uses satellites for the controlling of the remote. So it's apps and things like that. So that's great. And then also the remote control toys are something that I forgot to mention. Remote control toys are great for accessing pleasure for people with range of motion concerns. So people with like larger bodies, people that are living with disabilities, people that have just general range of motion concerns as it comes with arthritis and aging and things of that nature. So remote control accessories add pleasure and access to pleasure for people that may not normally have access. So that may be something, I'm not sure how many PTs we have in here or how many people that we have in this workshop today that work with people living with disabilities or people with range of motion concerns, but remote control sex toys are a great way to add pleasure to their regular routines. All right, the next one. I know you guys know this one. This is a finger vibe. And again, a finger vibe, the one I have, it looks like this. And basically it's a bullet with like a textured sleeve. Now this is gonna be one of those toys that's not insertable. This is like that jelly material. So it's only for external use. And you put lubricant on it and then you just put your finger in like this. So you can use it on the vulva, you can use it on the penis. It's also great, again, for range of motion concerns because you don't have to try to juggle a sex toy and your body. So it just kind of frees you up to explore yourself or your partner without trying to also have to manipulate a sex toy too. And I think when we talk again about accessibility and pleasure, when we add these are not even modifications. There are there's a gambit of sex educators that specifically deal in the living with disability space. And I have seen some amazing modifications on mainstream sex toys to make them accessible for people with different disability types. So something like that just comes that way and it's just already modified is really great and it just adds a level, again, of pleasure and access. When we're talking about something like this, just like something like this, when we're talking about all these smaller accessories, they're smaller, they're cheaper. Again, they're not invasive. They're not going to be offensive depending on who your partners are. And I just really think that there's something small and fun that don't really intrude on the pleasure, and they don't really impede on the connection. And I think that's the biggest thing when we're talking about sex toys and ways to support pleasure for people with chronic concerns and chronic conditions, is that we don't want to impede upon the pleasure. You don't want to make it's training wheels in a way, right? But you don't want to make it feel like it's training wheels. You want to make it feel like it's a part of the act, like it's a natural part of what's happening. And I think that the smaller toys and the toys that are just more ergonomic and are designed to create a seamless integration really, really support that in a way that we're not really connected to and concerned with as educators. We kind of missed the game. I think we missed the point on how pleasure accessories can help change lives in that way. And I was talking to Deborah before this started because I said pleasure accessories, and she said, well, I like that you're calling them pleasure accessories. And I think that when we refer to them as accessories, again, remembering language is alive, we call them accessories, it gives you a different framework. It gives you a different point of reference. You don't think sex toys. The sex toys are like the hee-hee, the salacious, the pleasure field, the back alley kind of. I said it was the cousin that never went to college. It's just like, it's kind of considered lowbrow. There's this connotation that sex toys are somehow this salacious, non-academic or non-helpful thing that are just, oh, I'm too old for that, or, oh, we don't do that over here. Whereas when we call them accessories, it kind of presents them in a way that helps you welcome them into your life space in a supportive and sex positive way. Now this one, it kind of gives it away because there's a hand in it, but something like this, and this is it right here. I actually have one. So something like this is what it looks like. It's great for any kind of sex. This is great for if you're doing anal sex with someone, vaginal sex with someone. It's just a really great accessory that kind of adds a level of pleasure because you don't have to try to, again, juggle the hand and the accessory, but it also gives you access to the pleasure, and it kind of integrates in the act that you are already doing. So something like this, if it's a person with a penis that's having erectile difficulty, they can still use something like this to satisfy their partner, to connect with their partner, and still actually be a part of facilitating their partner's pleasure. And that's the biggest hurdle I think that we get when we talk about sex toys in this way, is that we lose sight of the fact that our patients and our clients still want to be active participants in the pleasure that they are giving and or receiving. And so the toys that I'm showing you guys today leave our patients and clients the room to be active participants. Now this one, you guys, this is the one that I said is gonna be this is gonna be interesting. So this is my helper here, and I'm gonna show you guys this one. So this one, that is Tootsie. Now Tootsie is a great accessory for lots of things. So when I talk about this accessory, it's designed for a penis, but it's great for a person that has a penis that's having erectile difficulty, but it's also great for a person with a vulva that's having challenges or maybe even having low libido, and they don't necessarily want to engage in vaginal sex with their partner, but they do want to contribute to their partner's pleasure. So something like this is a great way for everyone to kind of connect to the pleasure as a team. So I'm going to move my camera down a little bit so you guys can see. This is the helper here. Now this is what Tootsie looks like. Now if you notice, the ridges of the inside match the muscle structure of the vagina, okay? And also Tootsie is almost anatomically correct. There are inner and outer labia here, and it slides down on the penis. So we're gonna use some lubricant, and we're gonna lube up the penis, and then you're gonna use lubricant, and you're gonna lube up the accessory. It's very important that you lube it up on the inside and the outside, and then you'll put the labia over the head of the penis, and then it goes like this. So now it becomes an aid to where, again, if the partner with a vulva has a low libido and they're not necessarily interested in vaginal sex for themselves, but they want to contribute to their partner's pleasure, this is a great way for that to happen. It's also a great way to help build an erection for someone that's having erection difficulty. So then you have this, and again, it matches the muscle structure of the vagina. So it feels similar to a vagina, but you can tighten and release in different ways that you can't with your own body. So you can change the pressure, the rhythm, the stroke, and everything. Also, you can create different levels of suction. So you can actually pull, you can pull and twist, and it creates a suction. I don't know if you can see that. It creates like a suction sensation. So again, it helps build an erection if you're having erectile difficulty, but it also is a great way for the partner that's not having the sex to connect to the pleasure of the person that he is. And I think, again, when we're talking about sex toys, we're not really looking at them as accessories for single people or accessories for people that don't have partners, because they don't have anyone to have sex with and things of that nature. And I think we have to get out of that mindset and separate ourselves from the connotation that we already have in our minds and the prejudice that we already have in our minds against sex toys as a point of professional development. Okay. So then we have vibes and pumps and lubricants and stimulators. Now I want to show you guys, and you see at the bottom, my left, I don't know if it's what it is for you, but the hollow strap-ons. Now I have a few hollow strap-ons to show you guys, only because I think these are amazing. And I really, again, when we're talking about connecting to your partner's pleasure and being an active participant in providing pleasure for your partner. So we have something like this. This, actually, you see the hole is down here, there's a hole here, and it's the length of a penis. But if you see inside, I don't know if you can see that here, there are textured nubs on the inside as well. So that would actually help a person with a penis that is having some erectile difficulty. The way you use this, I'm going to show you guys how to use it. So you put lubricant inside, okay? And this is actually a different kind of body safe silicone. This is not the firm silicone like this. So this can be inserted. This is not it's not a TPE, it's not a latex, it's not any of that. So it can be inserted into the body. So you lube it up on the inside. And then if this is the penis here, you would take this, and if they get to some sort of erectile state, they don't even have to be erect for this to work. So you just open it and slide it onto the penis, and then put this loop here under the scrotum like this. And so now it kind of adds some foundation to whatever erection they are able to provide. Okay, so there's lubricant and texture on the inside of the sleeve. It adds a little girth and support to the erection on the outside for that receiving partner. So something like this, again, allows the wearer to be an active participant in their partner's pleasure, despite having a chronic condition that impacts their sexual function. Okay, so that's one hollow strap-on. And then the other one I have is this one. Now, if you see this one, it has like a spiral on it, and it's open-ended, and it has this a bullet goes right here. I just didn't have the bullet in it, but a bullet goes here, and the penis goes here. So it goes, you put lubricant in it, and this is also textured on the inside. And I want to explain to you guys, the texture on the insides of these accessories is really, really important, because not only does it help the wearer, which is, we're going to assume is the person that's having the sexual difficulty, it helps the wearer feel stimulation and feel arousal as well, and help participate in facilitating the pleasure of their partner. So what could happen is they put on one of these accessories and it feels great to them in a different way, and they actually do start to get aroused and have their own erection, and may not necessarily even need the support, but it just acts as an enhancement as opposed to a support. So it's very important that we have the texture on the inside, and that we put lubricant on the inside, and we put lubricant on the penis, because when we're talking about supporting pleasure for both the wearer and the receiver, that is integral. Okay, so when we put it on, You slide it on here. And one thing you'll notice about this accessory that's different than the other one I just showed you. Let's get it on here. And this one fits a little more snug because it's a different type of support for the erection, okay? So you see the strap goes under the scrotum, and the big difference between this accessory and this one is that this one is open-ended. And that's important because, again, when the head of the penis is exposed, this is the most sensitive part of the penis. So if the head of the penis is exposed and the shaft of the penis is supported with an erection, the erection is supported with this accessory, then again, it starts to add to the pleasure of the wearer as well. And they can still feel their partner, they can still experience their partner, but then they are also contributing to their partner's pleasure and receiving pleasure themselves. So I think that's a big thing, a misconception about sex toys. Two is that when you talk about strap-ons and fallacies and things like that, we disconnect from the pleasure of the wearer. We don't even really consider how the person wearing the sex toy is feeling or if they're experiencing pleasure. And I think something like this is a great way for us to see, well, yeah, they do. There are ways to experience pleasure while wearing some sort of accessory. The next two things I want to show you guys are very related.
Goody, I'm sorry to interrupt, but before we go move on, we do have two questions about the item that you just showed.
Okay.
One person wanted to know what happens if the person wearing it gets fully erect while wearing it.
Okay, so you mean this one, the open-ended one?
Yeah, I think, yeah.
Well, yes. This sex toy is actually designed for a fully erect penis. It's not necessarily designed for a support for an erection. I like sex toys and I like researching different ways they can be used and aftermarket ways to use them. So I actually have done my own research with some clients that I have that experience erectile difficulty, and they used it this way. And they are the ones that told me that it was a good support for their erectile difficulty. In the event someone was to reach full erection wearing something like this, all that means is the wearer, the receiving partner would just get more girth and more firmness. So if this is a very, I don't know if you can tell, see, it's a very judgy, stretchy situation. So if they were to reach full erection, the tapered end of this toy fits right behind the head of the penis. So it would just give you a girthier penis. So if it's too wide for you to take comfortably once they get a full erection, you can just take it off and maybe put a cock ring on, or take it off and just see how well the erection lasts without it, if it's something that becomes uncomfortable. But you can also slide this back. So let me put it back on the penis here, because it'll also, okay. So if the penis is fully erect, so you see, even on this is a fully erect penis, it just adds more girth. So what you could do instead of taking it off so that you still have that support is to just pull it back. Your partner could just pull it back while they're penetrating, and it would still have the same impact, right? So the tightness and the support would still exist, but then they could kind of decide how much of the accessory they want and how much of their partner they want to feel. But if something like this becomes uncomfortable for the receiving partner, then they could just pull it down like this or just take it off.
And how about the other one? The person's clarifying that they wanted to know, what if a person had a full erection with the other toy?
Again, these are designed for full erections. So if the partner does get full erection, it's just gonna add girth. It's gonna add a little bit of girth to the penis. So the receiving partner will get a little bit thicker of a penis than they would normally get with their partner without the accessory. But because the inside is textured and lubricated, both partners will still get pleasure from it. So it's not necessarily something that you need to discontinue if they get a full erection on their own. It's just something that's going to support either way.
Right.
Also,
gotcha.
Even though this tip is closed, this is not a condom. Okay. I had some clients think that, oh, if I'm wearing this, I don't have to wear a condom. Absolutely not. This is still a porous material. And I don't know how porous it is, but this is not a condom. So if you are wearing condoms with your partner and you're using accessories, you still want to use condoms with your partners.
Thanks, Goody. One more question here. related to the hollow strap-on. When you're pulling down, do you pull down the foreskin the same way that you would with a condom? Are there any different? Yeah, okay.
Yes, yes, and that's great. So when you have an intact penis versus a circumcised penis, if you have an intact penis, any of these accessories, you're just gonna wanna pull the foreskin back before applying the accessory.
Okay, we got a couple more questions, but I think they're general, in general related to sex toys, so we'll hold those.
Okay, so the last two things I want to show you guys is just a general cock ring, which is this, and this one actually vibrates, so it's not a real general cock ring, but a lower end cock ring. So this one is very tight and it stretches. I don't want you guys to be concerned with, you know, if your partner's penis is wider than my arm, you have a whole nother set of circumstances that you need to navigate. But this is, so you see it goes from this size to the size of my forearm. But this again is designed to just maintain an erection, to keep the blood flow on the other side, inside the penis, as opposed to allowing the blood flow to go back into the body. But cock rings are often used with penis pumps. Now, the penis pump, I don't know if you can tell, but you see it's not, it looks like there's a wide opening. It looks like it's wide all the way up, but it's actually tapered in here. And the reason it's tapered is because you can put a cock ring on first. The best way to use a penis pump is to lubricate your penis, put a cock ring on first, and then put your penis into the pump and pump it, because that cock ring will hold as the pump pulls the blood into the penis and starts to form an erection. That cock ring will hold the blood in the erection that you're creating. Okay, so a lot of times people don't know that you're supposed to use cock rings with penis pumps, and so when you're talking to your clients, when you're talking to people, patients, clients, what have you, just it's an important note that you want to give, is that using a cock ring with the penis pump is going to make it more sustainable for them. There are also clitoral pumps and things like that. And when we talk about clitoral pumps, I don't even have one here to show you guys because they are not as well researched in their design as penis pumps. And as you may or may not know, the clitoris has 8,000 nerve endings, where the head of the penis only has 4,000. So you don't really want to challenge your nerve endings and your blood vessels in your clitoris when it comes to a pump. The entire clitoris looks like this. This is the entire organ that is the clitoris. This is the part that we see in the vulva. This piece here. And so when you're talking about using a pump on something, you're talking about using a pump on this entire organ. And so I really don't think that they are well researched enough for me to suggest or refer or demonstrate them in that way. So those are going to be more strictly for pleasure and kink, not necessarily something that is about accessing pleasure for people with sexual difficulty. So I know lubricant, I mentioned lubricant earlier. Lubricant is an amazing intervention when it comes to sexual pleasure because it reduces friction and it restores moisture. Now, it depends on what type of sex you're having. If you're fluid bonded with your partner, meaning you're having condomless sex, then you can use oils. And people want to use coconut oil and grapeseed oil and extra virgin olive oil because they want natural remedies and natural things like that, which if you are fluid bonded, meaning you're not using condoms, you can use extra virgin olive oil and grapeseed oil and things like that. I would not suggest I would not suggest coconut oil as a natural lubricant simply because it's solid at room temperature. And when something is solid at room temperature, it may get solid at room temperature inside your body too. So if you're using lubricant for sex, anally, vaginally, whatever, once your body temperature goes back to normal, that coconut oil could then become solid go back to solid form. And it's going to create different bacterial and pH balance challenges that you're not really going to want to navigate. I don't think oil is a good lubricant in general if you're using condoms or if you're using sex toys, because even if you're using non-latex condoms, oil is detrimental to condom use. It breaks them down very, very quickly. Also sex toys, oils break down sex toys. So if you're using sex toys or you're using condoms, oil-based lubricants and natural oil lubricants are not for you. Water-based lubricants, some silicone lubricants. We even have some hybrid lubricants now that are water and silicone together. So you get the benefits of water and the benefits of silicone in the same product. But when we're talking about people with vulvas and how the texture of the skin of the vulva changes and all of those things, these are some products that actually help restore the moisture, restore the pH balance, and reconnect to what natural sexual response looks like in a body with a vulva. Good Clean Fun has a great pH balance gel, and it's good because it restores the pH as well. It doesn't have any parabens in it. It doesn't have any isotonics in it. And so it's very wholly organic, so it doesn't impede your pH balance, okay? Now, normally, I would never suggest a KY product. I'm not even gonna lie to you guys. I do not enjoy endorsing KY products because they have lots of harmful ingredients and they tend to get sticky really quickly, which holds bacteria to the body, which increases pH challenges and vaginosis and all these other things. But the KY liquid beads are actually insertable liquid ovules, almost, I'm looking for this word, and I can't think of it right now. Suppository, that's the word. It's almost a suppository like bead of lubricant, and you just insert it vaginally, and it just kind of melts down inside the vaginal canal and mimics your natural moisture, but it also encourages your body to create that natural moisture as well. It's pH balance friendly, and it is condom compatible. KY liquid beads are the only one that I found that were condom compatible because they did not contain oils. So that is the only thing from KY that I'm ever going to say is awesome, but this specific accessory from KY is great. And then the Replenish is a great line. It has, you know, lots of pH balance restoration products, but the product on the side, it lasts up to 3 days. So you don't have to do it right before you have sex or the day. With Good Clean Fun and with KY liquid beads, you might want to put it in a few hours before you're going to have sex, just to give the suppository time to melt and blend with your body. Whereas Replenish, you can insert one every 3 days to just give you a kind of consistent vaginal moisture, and again, restore that natural pH balance and inspire your body to create its own natural moisture. When we're talking about sexual difficulty for people with vulvas, the moisture and the loss of moisture because of the hormonal changes is absolutely the biggest hurdle that we have to jump, because that hormonal change impacts every other thing around the vulva. It impacts again, the skin of the vulva, the skin over the clitoris, the clitoral hood. It impacts the ability to get wet. It impacts vaginal, like the sexual response when the vagina elongates to prepare for sexual intercourse. All of those things are impacted by the hormonal changes. And even if you're menopausal, you still have a menstrual cycle. And so depending on where your body is in that menstrual cycle, your body, your vulva tissue and skin and things will be challenged as well, because the cervix sits higher in the vaginal canal at different points in the menstrual cycle and lower in other points. So even though you are not actually experiencing a menstrual flow, you're still going through that menstrual cycle. And so the hormones are changing even more without the estrogen and progesterone that you naturally would create prior to menopause. So these three things, these suppositories and these beads, are a really great support for people with vulvas when it comes to sexual dysfunction as it relates to changes in the vaginal tissue and canal. Okay.
Goody,
Everybody going at the same time. There's a question that's been here for a while that is about a different issue.
Okay.
What toys do you recommend for people who experience pain with vaginal penetration?
Okay, so for people that experience pain with vaginal penetration, we have to kind of dig deeper first before I can really answer that. There are a couple of different ways to answer that. So if the pain is due to lack of lubrication, that's going to be something different. I would suggest lubricant first and foremost. I actually had a client that had an issue with painful penetrative sex. They were using lubricant, but they were using a gel lubricant. And so a gel lubricant is more viscous, it's thicker, so it adds friction. It does not reduce friction. So you want to make sure that your clients are first and foremost using a liquid lubricant. And once you decide that, once you figure out that they are using a liquid lubricant and sex is still painful for them, you might want to investigate like how they're doing, how the foreplay is going and all of that, because sometimes there is no foreplay, they're just having sex cold. And so that's why it's going to be painful. There's not really a toy for that because the body is not prepared for sexual engagement. But if all of those boxes are checked and they're still experiencing painful vaginal sex, I would think that a dilation kit would be a great way to start, and talking to their medical professional around the existence or presence of vaginismus, which is a super tightening of the vaginal muscles to where it's so tight that they can't really have pleasurable vaginal sex, but not a sex toy necessarily, but vaginismus. There are dilation training kits that kind of go from smaller to larger to larger. Something like this may help. This is it's a slim vibe, and you see there are different levels of it. So just kind of like putting some lubricant on this part and just putting in this part and then going down to this part, like it graduates. So something like this could even help with a partner, if they had a partner trying to figure out how to navigate pleasure for them. That would be something that they could incorporate as well. But if they're having painful vaginal sex, the first thing I would do was check off, the lubricant and the foreplay, and then check off that vaginismus is not a concern.
And two quicker ones. How should you clean sex toys, and where can the hollow strap-on be purchased? This person said they didn't see it on your website.
Okay, so the hollow strap-on, both of those I hadn't added back to the site because they were sold out, but I'm adding them back today because I got an email this morning because I told my vendor, I was like, hey, I'm going to be showing this. So it'll give me the day and it'll be back on the site. As far as cleaning the sex toys, I love this part. So these toys, the toys that are like judgy and jelly and porous in nature, you're going to want to use sex toy cleaner for those. And that's specifically because it's designed for those pores and things like that. It's like you wouldn't use shampoo to wash your whole body. You have a specific soap for that. So you have a specific soap for porous sex toys. Body safe silicone sex toys and medical grade silicone sex toys can be cleaned with antibacterial soap. I could just hold it in my hand and just wash it with antibacterial soap the way I'm washing my hands. Other types of sex toys, the metal toys and the glass toys are absolutely non-porous, and so you can use soap and water for those, antibacterial soap and water for those, and you can also use any kind of lubricant on those toys as well because it won't heat them up. You can use oil or silicone or water or whatever. But cleaning sex toys is very important, and I think from a sexual health aspect, a lot of people miss that they need to clean their toys, especially if it's something like a bullet or something that's like firm and like something like this that's not porous. They don't think they need to clean it. And so it's really important that we highlight cleaning sex toys because that's like eating with the same fork every day and not washing it, right? You can introduce, even if it's your own bacteria, you can introduce bacteria back into the body that may not necessarily need to be there and cause your own sexual transmitted irritations. And so it's important. So I'm glad someone asked that question about cleaning the sex toys because I didn't mention that, but it's very important.
Goody, before we do maybe two final questions, and Debbie, if you don't mind moderating them, I just wanted to ask you, because we're going a little bit over time, is it okay if we take a couple more questions?
Yeah.
Okay.
If y'all are good, I'm good.
Okay. And folks, if you need to leave, we understand. We'll miss you. But Debbie, do you mind fielding the last few?
I do see that Erica has her hand raised. Hello, Erica, are you out there? Can you unmute yourself?
Hi.
Great.
Yes, I have a couple questions for Ms. Goody. Let me see really quick. I put them on the thing. One, what what are your thoughts about lubrications that have CBD in them, especially for those vulva owners who are going through menopause, or because as you know, like women who have gone through cancer treatments as well, their effects are similar to like women or like vulva owners that are going through menopause.
Mhm.
What is your recommendation about that, or just it in general?
I think lubricant with CBD is great. I think it's great for all body types. It's great for penises and vulvas, especially those that have survived cancer or that are undergoing treatment right now, just because of the pain management properties of it. I think even people that are not dealing with pain management. So someone, the question about painful penetrative sex, the CBD may be good for that as well. It's not an immediate, it's not like putting a Tylenol on your body, right? It's not a pain reliever in that sense, but it's a holistic body pain relief kind of thing. And so I'm excited about the fact that there are so many canalubes and CBD lubes on the market, because they're important to, sexual pleasure in that way. So I thank you for asking that. I'm all on board with CBD.
Yeah, I think that it's great that they're coming up with that. And my recommendation, I guess, is to maybe apply it about 30 minutes prior to intercourse or any type of vaginal intercourse, so that it gives it time to work.
Right, to work.
Right?
And I think even to go a step further, because remember we were talking about the suppositories and the insertables and how they kind of inspire your body to start reproducing that natural moisture. It could be part of your sexual health regimen. Like you could do it on like daily, on a regular basis,
Right.
to just kind of make it part of your routine.
Yeah.
Because then it's in your bloodstream consistently. The pain relief effects are in your stream consistently. It's not THC, so it's not something that you're necessarily going to be compromised by. So it could be something that you even just add to your normal sexual health routine.
Yeah, I recommend it for, like, again, women or vagina or vulva owners who have pain regardless, whether that's vaginitis or daily pain, like women who don't lubricate whatsoever and there's a lot of friction daily. I think that would be something that would benefit as like a daily moisturizer, just like how you apply your daily moisturizer to your body. You got to take care of your vagina as well, and that's one way of doing it.
And also for trans clients, for trans women, there's a recommendation to lubricate and do that kind of a daily moisturizing routine, and I think CBD will be great for that, just to kind of soothe maybe the past, like how I don't know if you've ever seen sexual affirmation surgery, but it looks like it could be very traumatic to the blood vessels in the pelvic area. So something like that would be good for trans clients as well.
Not only that, but like whoever the trans clients who are going through the hormonal treatment, you never know what that can also do for them. So I think it's a great thing, and I think everybody should try it. I definitely recommend it for menopausal women who have gone through cancer treatment and just don't self-lubricate, or they're constantly in pain from the friction. It's just the way it is. It's that. My other question to you is, what do you recommend for clients who just cannot have orgasms whatsoever?
Oh, wow. I get this question a lot. They're like, oh, I've never had an orgasm. Well, first and foremost, I tell them that to connect sensually versus sexually, right? So sensually is living through all 5 of your senses. It's experiencing pleasure in a non-sexual way through all 5 of your senses. So sight, smell, taste, touch, sound, right? And so when you live more sensually, you experience sex through all 5 of your senses, and it allows you to connect to the pleasure and adds layers to the pleasure that you're experiencing. Also, we focus on orgasm as the destination of sex, but we don't focus on the journey, which is the pleasure. So I always tell clients to just kind of relax and enjoy the journey, and the orgasm will just kind of happen. If you start your sexual experiences focused on the orgasm, you're not going to get it, because you're focused on the end game, and you're skipping over all the things that actually support the creation of the orgasm, right? Like a watch pot never boils kind of thing. So I always tell people to just kind of relax and enjoy the journey of the pleasure, and then lubricant, and try to think about not just your genitals when you're having sex or being intimate with
Right.
someone. Think about the way their kisses feel, the way their skin feels, how they smell, what their breathing sounds like. Connect your breathing to theirs. Like, break down each sense and what you're experiencing in that session per sense. And it just kind of connects you in a more enjoyable way to what you're experiencing.
Thanks so much for the question, Erica. And I just want to note the time, because I think we could really have a wonderful evening going on for another half an hour or more. But I want to be respectful of everybody's time, especially yours as the speaker. And Goody, thank you so much for this very informative presentation. I encourage folks to go check out askgoody.com and learn about these resources, as well as if you're in a position to bring on Goody as a speaker at your organizations as well. I know that you're doing other Zoom style presentations, right?
Yeah. Mm-hmm.
Okay.
Yes.
Okay.
Yes.
Well, thank you so much. And so just to wrap up here, we'll send some information about the video, the recording for this afterward. I know there was some problems with the session last week or access to it with the password. So I'll figure all that out and make sure I get people a link and a password if you want to watch the video. And thanks again to Tanash. Go check out their website. I'll include that in the follow-up as well. They have some great speakers as well. So thank you to Tanash. And next week, the session is going to be Love Education. What's sex got to do with it, with Robert Silverstone. Goody, thank you again. It was great spending time with you this evening. And thanks to everybody for attending.
Yes, thank you guys all for coming. And thank you for having me. I appreciate being able to share. You don't get to hear a lot about sex toys and pleasure when we're talking about academic sex ed spaces. So I really appreciate it.
I really value it. And Debbie, thank you so much for moderating.
My pleasure.
All right, folks, have a great night, everybody. Take care.